At the Good Life Cooperative, we believe everyone can benefit from a little guidance as they navigate along the healthcare landscape. Some doctors say that the human body is like a car. If you inherited good genes from your parents, your body is like a high-performance, well-made luxury sports car that doesn't break down often. And while you can't change your body the way you can change cars or prevent your body from getting old, regular health screenings and lifestyle modification are essential to keeping you healthy. Just as getting your car serviced regularly and driving it carefully will help it last longer. This is how you do it.
What did you cook last night? The sink is clogged again. Didi, help me unclog the sink. Wait, are you supposed to go for your medical appointment today?
I don't think I'm going. I have to attend the business meeting. I'm fine, just a bit bloated, that's all.
Why is it not important? You have been like this for a few weeks now.
I don't feel any pain, and there isn't any blood in the stool. So I think I'm alright. Anyway, I passed all my health tests last year.
Yes, but, Uncle, just because you used the toilet yesterday doesn't mean you don't need to use the toilet today, right?
Based on the latest statistics, colorectal cancer is the most common cancer in Singapore. However, colorectal cancer can be cured with over 90% success if detected early. That is why doctors recommend colorectal cancer screening. Unfortunately, the majority of Singaporeans still do not go for screening properly and only see a doctor when symptoms develop.
Good morning. Can I cancel the appointment with Dr. Jeremy?
Mr. Lam? Oh, can I ask why you're cancelling?
I really feel fine, and the last screening result was fine.
Mr. Lam, you're over 50 years old, right?
Yes.
So, Mr. Lam, the risk of colorectal cancer increases with age. 90% of patients with colorectal cancer are over 50 years old. Hence, we recommend colorectal cancer screening from the age of 50 years onwards. And besides, you have a history of polyps. Remember the last colonoscopy you did?
Yes.
A history of polyps means an increased risk of new polyps forming. And you know you have a family history of colon cancer or polyps, right?
Yes.
Yeah, so Mr. Lam, the risk increases as more family members are involved.
But I really quit smoking and I only drink occasionally. I'm really not comfortable doing the colonoscopy just for something that I might or might not have. Besides, I did the occult blood test last year and the result was fine.
Right, Mr. Lam, the stool test needs to be repeated every year in order to be effective. But because of your family history, experts recommend that you proceed directly to a colonoscopy because that is considered the gold standard for cancer and polyp detection. And in fact, many people opt to proceed directly to colonoscopy because that can prevent cancer altogether. And this is done by removing the precancerous polyps even before they turn cancerous. So, because of your medical and family history, your previous lifestyle habits, and your present health condition, I do highly recommend that you keep this appointment, Mr. Lam.
Okay, I will come. Can you walk me through the colonoscopy?
A colonoscopy is a procedure that allows the doctor to examine the internal lining of the large intestine. The colonoscope is a thin, flexible tube that has a light source and a video camera attached at the end. This allows the doctor to view the inside of the colon real time and to take pictures or videos. The entire procedure typically takes about 30 minutes and it is usually done as a day case procedure. Endoscopy equipment itself has evolved. The width of the tube that is inserted is now only the width of your littlest finger. And in addition to housing a camera, other instruments can be inserted through it to remove polyps so that surgery is avoided or kept minimally invasive. Polyps are abnormal growths that arise from the inner lining of the colon. They may be pre-malignant and become cancerous over several years. Polypectomy refers to the removal of polyps during endoscopy. If these colon polyps are removed before they become cancerous, one has effectively prevented cancer. This strategy to prevent colorectal cancer has been well proven in many good studies. This can avoid surgery altogether. Small polyps like this are the commonest type of polyp found during colonoscopy. They are pre-malignant and can become cancerous over 5 to 10 years. These small polyps are easily removed using a cold snare technique. This does not even use electric current for cutting. Done correctly, this technique is proven to be 100% safe and effective. The scar cannot even be seen. This is a much larger polyp that appears stuck to the colon wall with a large base. To remove this polyp safely, liquid is first injected into the polyp base to lift it away from the colon muscle wall. This creates a safe area through which the polyp can be cut. The polyp is then encircled and grasped using a wire snare. A small electric current is used to cut the polyp in one piece. This technique is bloodless and safe and can remove the large polyp completely. Only a very small, clean scar is left behind. This is painless and heals within a week. This polyp is even larger and has a short but broad stalk. The stalk contains large blood vessels that can bleed profusely. A polyester loop is first applied to the base of the polyp to tie off the blood vessels and prevent bleeding. A wire snare is positioned precisely over the loop and used to cut the polyp. The polyp is now retrieved for further examination. The loop will drop out on its own in 1 week's time and does not need to be removed. The polyp site is now a clean stump with no bleeding. This particular polyp was found to contain early cancer. However, surgery is not needed as the polyp was completely removed during polypectomy. Still think colonoscopies are unnecessary? Here are some myths we'd like you to consider. Myth number 1. Colonoscopy is a painful and uncomfortable procedure.
Daddy, how was the procedure today?
It wasn't as stressful as I thought it would be compared to the last procedure I did 10 years ago.
Modern sedation is light yet effective. It allows patients to sleep through the procedure with minimum anesthesia risk. Some endoscopists are able even to perform unsedated colonoscopy. In this procedure, modern techniques and equipment are used to perform colonoscopy in a manner that is painless with the patient fully awake. Myth number 2. Colonoscopy is a risky procedure.
Were you scared?
A little bit at first, but Dr. Lee reassured me, and he has performed many such procedures.
Colonoscopy is a very safe procedure with an overall risk of less than 1%. New studies and techniques have replaced the older, riskier ways of colonoscopy and polyp removal. These have reduced complications by more than 10 times over the last 10 years. Myth number 3. Colonoscopy is not fully accurate.
Do you think he did a good job?
Dr. Lee said that colonoscopy was not 100% accurate, but it's still the most accurate way of examining the colon.
New technologies such as high-resolution imaging and narrowband imaging have greatly increased the accuracy in the last 10 years. These new imaging technologies allow doctors to detect growths that would have been missed with standard techniques. Nonetheless, accuracy is still very dependent on the doctor doing the colonoscopy. New quality indicators have set benchmarks for doctors to attain to assure patients that the accuracy is good. Patients today are also better informed and are better able to select their own doctor to do the colonoscopy. Myth number 4. Large polyps cannot be safely removed during colonoscopy.
And he found something.
What? What did you find?
A large polyp this big, but Dr. Lee has removed it.
I thought something the size would need another surgery.
Advanced polypectomy techniques have transformed the management of colonic polyps. Doctors who choose to specialize in this area utilize a variety of new instruments and techniques to remove all types of colon polyps endoscopically. Although the risk is higher than basic polypectomy, it is still much lower than the risk of surgery. Myth number 5. Bowel preparation is very difficult. Good preparation is crucial for an accurate colonoscopy. Recently, numerous studies have taught doctors the optimum way to perform bowel preparation. This is in terms of type, timing, and volume of preparation. Modern bowel preparation is individualized for each patient according to his digestive habits. These can be tailored according to various lifestyle needs and schedules. Bowel preparation today is safe, effective, and much easier to consume with new options and flavors compared to as recent as 5 years ago.
I'm sorry, you have to go through that.
It's not really that bad actually. The whole procedure was not difficult or uncomfortable, which I thought it would be. And by the way, I think you should go for it since you're turning 50 next year.
Is it necessary?
Just because you go toilet today doesn't mean you don't have to go toilet tomorrow, right?
Exercise regularly. Exercise promotes healthy gut movement. Drink adequate fluids. Typically, 8 to 10 cups of water are needed every day for most healthy adults and is required for healthy gut functions. Take adequate fiber. 25 to 35 grams of dietary fiber is the recommended amount to promote healthy gut movement. But avoid too much fiber, which can cause bloating and other digestive symptoms. Avoid too much oily or fatty food, which can affect gut movement. Stop smoking. Smoking is a risk factor for many digestive conditions. Drink in moderation. Alcohol can damage the liver, pancreas, and stomach. Do not strain when passing motion. Straining is one of the biggest risk factors for developing bowels. Drink probiotics. Probiotics are also found in cultured milk drinks. They help to increase good bacteria, decrease bad bacteria, and improve the environment in the intestines.
Good morning, Mr. Lam. This is Cynthia from Gut Care Clinic. The biopsy report from your colonoscopy is back.
Oh, really?
The report is negative, Mr. Lam. That means it was not malignant.
What a relief.
Yeah, Mr. Lam, I just called to inform you that there's no need to come back.
Thank you for the good news.
But we will see you again for the next colonoscopy, yeah?
Sure, I won't forget that. Thank you.
This educational video is brought to you by the Good Life Cooperative, Olympus Singapore, Yakult, and Gut Care Clinic.